Hello, I'm Dr. Chhavi Mehra, Quality Head and Physician at RxDx Healthcare, Bengaluru. In my 25 years of practice, I have specialized in treating many common conditions, out of which diabetes, hypertension, thyroid and asthma are the most common. In this video series, we will be educating you on diabetes. This video series has 6 parts. And in the first part, we will talk about what diabetes really is in the layman term. In the second episode, we'll talk about the scope or the scale of diabetes in our country. In the third one, we will talk about regulating your sugars at home and what tools are available. In the fourth series, we will talk about importance of exercise for diabetes. In the fifth, you will hear about diet and nutrition importance for diabetes. And in the sixth episode, we will talk about how diabetes can be managed while you are at home. So in this first episode of education on diabetes, I wanted to tell you about what diabetes really is. Diabetes is a metabolic disease in which there is dysregulation of your body's sugar levels. It can be from a lack of a hormone called insulin, or it can be that you have enough insulin but your body is not using that insulin. The first type of diabetes is called the type 1 diabetes mellitus, and it happens because we do not make any insulin in our pancreas. The second part is called the insulin resistance diabetes or adult onset diabetes mellitus, and that is because our body does not effectively utilize the insulin that we make. The third type is called impaired glucose tolerance or impaired fasting hyperglycemia, and in this kind the body is at an intermediate stage between having high glucose levels and developing diabetes. The fourth type is called the gestational diabetes, in which diabetes happens during pregnancy and requires a very structured management. Key contributors to developing diabetes mellitus are inactivity, being overweight, obese, lifestyle issues, an aging population, rapid urbanization. The complications from diabetes mellitus not only happen due to high sugar levels, but also from the inflammatory effects of the disease. There is heart disease, kidney disease, retinal detachment leading to vision losses. There can be peripheral neuropathy, there can be blood flow issues. This can lead to amputation. In the next episode, we will be discussing the scale of diabetes in our country.